So today we will be discussing about the management of socially challenged child. So let's see who is a socially challenged child. So a socially challenged child means those children they are having certain disturbed opportunities for their healthy personality development, and this is mainly happening because of certain kind of social issues, and such children are known as socially challenged child. And these children include orphan child, the child who is performing child labor, then material deprivation, emotional deprivation, etc. Then, the child who is described as socially handicapped child, they may feel very uncomfortable with certain social situations, and it will be very difficult for them to interact with the other children in a normal way. And they can be limited in their extracurricular activities depending upon their specific issues. And because of this only, the other children will look upon this particular child with a disability. Okay, and due to these differences, there are certain kinds of barriers are usually developed between the normal child and the socially handicapped child. And because of that only, these handicapped children, they usually feel a feeling of isolation from the normal children. So next see the types of socially challenged child. So first one is neglected child. So neglect is the process where it is a failure to meet the child's basic needs, like his education, his clothing, food, etc. So here the failure to meet the child's basic needs are happening. So because of that only the child may be feeling hungry or he may left us dirty without proper clothing, proper shelter, supervision and adequate healthcare services, and these can put the child in a case of danger, and it can also leads to certain kind of physical as well as the mental problems in the child. Next is orphan child. So an orphan child means whose parents have died or whose parents are unknown and permanently abandoned them. In common usage, sometimes we usually say the child who lost both his parent also as an orphan child. Okay. And next is the children of divorced parents. So, divorce that is happening between the couples or the parents, which will cause a deep matter of concern in the child, and this will be leading to behavioral reactions in the child. It usually depends upon the age of the child. So, if the child is very small, it may be affecting him in a varieties of ways. So, when parents divorce, it can vary based upon the child age. Some people or some children they will react to that divorce in a normal natural understanding way, whereas some other children it may be for them very difficult to cope up with the situation. And let's see what are the problems faced by the socially challenged children. So they will be having poor performance in their academics. So they don't have anyone to take care of their studies in the family, and because of that only they may lose their interest in the academic section, and hence this will be leading to a poor performance in their academic activity. The same way they may lose the interest in their social activity. As I said you already, these children they may be having difficulty with the cope up with other children in the same class or something, and as a result they will be losing their interest in the activities, and they will be feeling a kind of isolation. Then difficulty adapting to change. So whatever change we provide to them, they won't able to adapt to that particular change. They won't want to cope up with a particular school or a situation, etc. Then they will be emotionally sensitive because the divorce of the parents or early death of the parents will leading to certain kind of emotional sensitivity in the child, and sometimes they may be very angry, they may be so much irritated, etc. That's what anger and irritability, and they may be having a feeling of guilt that others are not taking care of him, and why this happened only to me, like that a guilt feeling will be there. And usually it is associated with the severe health problems like attention deficit disorders and all. Okay, so these are the common problems we can see in a socially challenged child. And next, how we can manage these socially challenged children, or why it is important to manage such children. So it's very important to give appropriate rehabilitation activities to the socially challenged children. So first one, we can follow their interest. So enjoying others will come more naturally when a child is doing something when they are really interested in. Okay, so never force the child to do some activities, and it's according to their wish they will perform their activities. So whether it is participating in a favorite sports or playing certain kind of instruments, etc., all these activities will help to build certain kind of social skills in the child. Then allow them to socialize with the other children also, or if the child is having any kind of capability, make the child to participate with the other children also. So this will also helps to improve the social skills as well as the social ability in the child. The next one, learn to ask questions. So this is an important thing. So every time we should motivate them to ask certain questions, okay? Because sometimes the child usually get nervous when they have any doubt or any conversation lags, etc. So in such situation, we can make them to speak or we can ask certain questions to them so that they can give you the correct answers and they can develop a social skill. Uh, so the best way to find about is to making a connection by asking questions with the others. Next is practice role playing. So role playing means it's a pretended play that the caregiver can do along with the child. So this will helps to improve the social skills, like building a house or like a doctor or such activity will helps to improve them to develop their social skills. So suggest the ways through which the child can effectively talk with the other individual, and this will also helps in the development of body language, then smiling skills, maintaining the eye contact, etc. So the caregiver also should encourage these activities when they are actively doing the role playing. Next is teach empathy. Empathy means putting ourselves into one's own shoes. So here, the children should be taught regarding understanding of how others are feeling, or how much this will help them to identify how much they are feel connected to others. So the caregivers or the nurses can teach the empathy by talking about different situations, and in such situation how they will react, that they can ask. So this will help them to develop empathy. The next one is know the child's limits. So always these children will be having certain kinds of limitations, and the nurses or the caregivers must be aware about those limitations. So sometimes these children will be more social than others. So sometimes they will be so much shy or sometimes inverted and they don't want to interact with others. So all these things are coming naturally. So you should know about the child limit. For that, you can set certain comfortable settings, etc. For that, then as children can communicate with the others. Okay. The next one, be a good role model. So the nurse or the caregiver can be a good role model to the child. So why? Because the children are always watching their adults in their life and they always follow their practices. So if you follow good skills and good socializing abilities, the child will usually follow that. Okay, next is regarding the role of nurse. So how a nurse has to perform. So the nurse has to provide need-based rehabilitation program to the child, because every child is unique and each child may be having their own problems, and a need-based rehabilitation program has to be given. Then train the families also in the functional rehabilitation activities. Then modify the inappropriate attitude of the family and community towards the disability, and provide recreation facilities for the disabled child. This will help to improve the socialization skills as well as the communication skills. Okay. So next is regarding the prevention, how we can prevent the socially handicapped children. So improvement of the maternal health, because any kind of injuries or any substance abuse or any kind of depression during the maternal period can affect the fetus in a negative way. So that has to be avoided and the maternal health has to be improved. Then genetic counseling has to be given to the parents, those who undergone consanguineous marriage, etc. Because in the family, if there is any family history of socially handicapped, there are chances of transmission of the disease. Then genetic screening for the high risk people to prevent inherited disease. Then reduction of consanguineous marriages in the family by creating health awareness. Then universal immunization should be given to all children to avoid all kind of disabilities. Then improving the nutritional status of the mother and child in the remote areas. Then prevention of iron deficiencies and folic acid deficiency during the antenatal period to be carefully monitored. Then the use of teratogenic substances like exposure to X-ray, lead, other chemicals to be avoided during the antenatal period. So by providing all these measures, the socially handicapped children's development can be, or we can prevent the recurrence of socially handicapped children. Okay, so thank you, students.